Sometimes it feels like the sun will never rise, like the birds will never sing again. Believe in a power greater than what you are going through. When you don't know what to do, keep breathing.
That's right. When you don't know what to do, just keep on breathing. I'm Dave Nassani, and I'm with my lovely co-host Adrian Gruberg here on the Caregiver Space, and I'm at caregiverdave.com. And we are having a great day. Aren't you having a great day, Adrian?
So far.
So far, so good. Coming to you live
Yep.
and on demand 24/7 on numerous syndicated radio shows and podcast networks, 25 global audio and video platforms, iHeart, Radio, iTunes, YouTube, Spreaker, SoundCloud, Vimeo, etc., etc., etc. And we are proud to be voted #1 Caregiver Podcast on the top 50 on Player FM, and #2 Caregiver Podcast on Caring Village, and #3 Caregiver Podcast on FeedSpot out of thousands. And we have an especially exciting show planned for you today. Esther, you're going to have to help me with that last name. Let me see if I can try it. Mbabazi. No, that was bad. What is it?
My last name is Mbabazi.
Mbabazi?
Yeah, I'll take that.
Wow.
The M
Mbabazi.
is
Yeah.
Esther Mbabazi. And she lives
I'll
in
take
Norway with her husband, and she has 2 children, ages 8 and 14. She's an oncology nurse. And I'm a little distracted with my wife here. But she's going to talk all about cancer. And her mother had cervical cancer, and she beat it with treatment. And she has an idea about how scary it is for a loved one to be diagnosed with cancer. Esther's husband was diagnosed with cancer. I just lost a very dear friend with liver cancer. He was only 55. He left 2 young twins and a beautiful wife. It's devastating. So, Esther, welcome to the show. And I usually like to ask my guests, just who is Esther and why was she put on this earth?
I like to serve other people.
You like to solve other people's problems? Is that what you mean?
I like to serve other people.
Save?
I serve.
Save.
Life-saving.
Yes. SERVE. I like to serve other people.
Serve.
Okay, I got to get used to your accent here. I
Yes.
like to serve
I like
other
to
people.
serve, yeah. Yeah, I like to serve other
Okay.
people. Yeah.
Okay, well, let's get right into it. You've got a lot of experience as an oncology nurse, right? Are you still working as an oncology nurse, and were you one in Uganda?
No, I wasn't. I wasn't one in Uganda. I just became one in Norway after.
Oh, good for you.
Yeah,
And you work at a hospital?
I work at a hospital. I work on a gastrosurgical unit, and
Wow.
we have I don't want to say a lot, but we have many gastro cancer patients. Anything from esophageal to the rectum, anything in between.
Right.
Wow.
Yes.
So how has COVID affected your job and the hospital? I assume you've been very, very busy.
Yeah, COVID has, not me personally, but it has affected our patients. They are almost not allowed any visitors anymore.
Right.
Yeah. So it is only the ones who are on their deathbed that are allowed visitors, or the ones who have newly been diagnosed with cancer, that they need that support. They're the only ones who are allowed visitors. Yeah. And of course, we are scared and they are scared. We are scared of infecting them and they are scared of infecting us, and vice versa. So we use protective gear if we suspect if a patient has symptoms of COVID before we get the positive result or the negative result. So, yeah.
It's hard to believe we've been dealing with this for 1 full year. Are things getting any better in Norway?
In my area, we don't live in a big town. So in my area, we had a rough period right after Christmas because of all the travels. People are traveling back and forth. But they contained it. They closed down some schools and swimming pools and all that to contain it. But I think we are good now. But Easter is coming, so I don't know.
Easter's
Yes.
coming.
More travel.
Yeah.
Well, I
Because
don't know.
people don't really understand. Some people don't really understand, or they don't want to understand, or they don't make it a priority. I don't know.
But
How is the injection vaccination situation?
I got one, and I have already gotten the first one. We, the healthcare workers, have gotten the first injection. I got AstraZeneca. The first batch of people got Pfizer. Then I think they ran out of Pfizer. I don't know, but we got Astra. So we are waiting for the second one in a period of 2 months, I think. And I know some elderly people got vaccines, but I'm not sure which kind they got. So they are still vaccinating people out there.
Yes.
The
have you had
elderly,
any side effects or heard of any side effects?
I haven't had any side effects myself, but my coworkers, many of them had fever. They were running a very high fever and shaking and chills, but it went away after around maybe 24 hours.
So then it went away?
Yeah, it went away.
Yeah, I guess similar symptoms for flu shots, no? You get a flu shot, Adrian, don't you?
Yeah, but I've never had a reaction.
Mm.
I'm lucky. I get my second shot on Friday.
So you deal with caregivers as well, and tell me what your duties are as an oncology nurse for us that are not familiar with how the nursing and the hospital system works and the cancer units and all of that stuff.
Yeah, we see a patient will come in with a symptom or 2 or 3, maybe 4. Typically, anemia, unintentional weight loss, blood in the stool, fresh blood in the stool, night sweats, extreme night sweats, not the menopause ones, but the cancer night sweats are different. Everybody knows that people have to wake up and change their bedding. That is how bad it is.
Yeah.
So they will come in with a few symptoms, and the doctor or doctors or surgeons will look at the symptoms, and they will say, let us run a CT scan, some blood work, and maybe an MRI if they are not satisfied with the CT results. And then the patient will get their diagnosis. You have this cancer, we need to do biopsies of this and that. And then they'll have to wait for the biopsies, then they'll come back, and sometimes they will be operated on. They will have surgery before the chemo. Sometimes they'll have chemo before surgery. There are reasons why it's like that. Yeah, they have. Yeah. So that is how we get
the tumors. Yeah.
Yeah, shrink the tumors. Then they can go in and operate. Then some more chemo and maybe radiation, depending on where the cancer is.
Right.
Yes. So that is how we get to know our patients. They come in with the symptoms, then they get, and it is a scary time. You know.
So is
Yes.
do you deal with caregivers as well, or not really?
I deal quote unquote, because the moment you hear when the doctors suspect it is cancer, know that we go in and ask the patient if they have anybody they would like in the room, because the doctor would like to go over certain things with them. When you are in that situation, you're not picking anything the doctor is saying. Everything is going in here and right out the other ear. So many people need somebody to help them, like, soak up the information, then break it down later for them. So, but not everybody has that somebody. Not everybody has somebody to come and be with them. So they'll take the information, and you will see that there's like a wall there. Everything's just bouncing off, and then after they'll ask you, what did she say? What did he say? I didn't. Yeah, no.
Yeah,
It is
I've felt
very
that way
scary.
many times.
Yeah. So when the caregiver is there, the spouse, the husband or the wife, or the children, if it is the parents, the bigger children, the older children, the sister, the brother, we will take them aside because they need to soak this information, like I said, and digest it and let it marinate. So we'll give them a day or two. Then we'll see how it goes.
Yeah. Well, are things better? I know I asked you this before, but I mean, from a year ago or from 6 months ago, have things calmed down a little? Are people less paranoid? Are the staff more knowledgeable about what to do and handling things? Are the PP, is it PP or PPP? Do you have enough of
PPE.
them? PPE. Do you have enough of everything that you need, etc.?
Yes, right now we do. We didn't have in the start just like any other country because everything was just boom, abrupt. So now
Right.
we have enough protective gear, more than enough actually. We have more than enough. And we now know what to do. We now know how to clothe ourselves, how to
Right.
protect ourselves. And the doctors know what to do. Now, if a patient like that comes, they know how to treat them. All that was new. And there was a
Yeah.
lot of panic and fear and, conspiracy theories. And, you understand. Yeah.
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 So, when I keep forgetting my
I
questions. Do you have one
I
until
have
I
a
think of
question.
mine?
With COVID, the caregivers or the family members uh, can or cannot come into the hospital for cancer patients
Yes
to
and
visit.
no. Yes
They
and no.
yes and no.
Yes and no. The ones, at least where I work on my unit,
Yes.
we have the power to allow them in or not. So we will look at things. It is individual situation. We do not take it as a whole. It is an individual. We judge from the individual situation. If the patient is on their deathbed, if the patient is disoriented and they need
Yes.
somebody to speak for them, then they'll have their visitor coming because we don't know this patient and they cannot speak for themselves. Then we need
Right.
somebody who knows them to come in with them and help us.
So you're the
And they pay.
gatekeeper,
Sorry.
and that's an important lesson to Kate. That's an important lesson to caregivers because many times depends on your attitude and your negotiating skills and abilities to get through the head nurse or whoever is in charge, whoever the gatekeeper is. You get more bees with honey than with vinegar, so to speak. And a lot of people get so frustrated with the system and they take it out on you or whoever the gatekeeper is, and that's not
Yes,
going to help at all. In fact, it's
I
going to
know.
hurt.
I
So
know.
my
I know.
question
But,
was,
mm,
I know you're in the cancer ward and you do cancer things, but were they
mm.
moving everybody around and you were just doing stuff that everybody was doing because all hands on deck, so to speak, at the height of COVID?
Can you rephrase?
Were
I'm
you
not sure I
strictly
understood what you meant.
in the height of the COVID pandemic? Were you strictly isolated to cancer patients, or was the hospital in such a state that everybody was doing everything? Didn't matter what your specialty was.
We were briefed that a situation like that could arise, and maybe there would be need to do that, but it never happened. It hasn't
Okay.
Yeah.
yet happened, and we hope it doesn't happen. But we
I
were
hope
briefed
not.
and we were prepared. Yes.
Do many or do any of the patients that you were under for the last 12 months who had cancer, who you were treating, did any of them die? And if they did, was COVID the cause? or no?
I don't think so.
There's a
No.
lot of
This is,
confusion
I
as
would
to
imagine in a gastro unit, because there's not a lot of respiratory involvement, that the COVID aspect of it is lessened. That's what I would imagine, Dave.
Yes.
yeah.
Mm.
Well, if you say so.
No, it's not a matter of my saying so. I mean,
It's
you
true.
didn't say at the beginning that
She said it's true, so she
my
confirms
husband,
it.
yeah, no, my husband had lung cancer. He passed from lung cancer. So
So
I
they have
know,
ventilators
I
in the
know
cancer
about,
ward.
yes, I know about how to work with cancer nurses
Yeah.
and be the one that disseminates the information. And when you first hear that diagnosis, you're right. It takes a while to digest.
hmm Yeah. And so, but let's talk about caregivers now. You talk about why a living will is very important. Can you give some examples of patients who needed a living will and didn't have one, and what the consequences? What's the worst case scenario that can happen without a living will? I'm sure you've seen it all.
Yeah, I have not seen it at all, but I have seen, if some. Yeah, there are certain types of cancers that I'm going to use the normal word that spread to the brain, and depending on where that cancer is on the brain, that is what causes the problem. People usually have brain metastasis, cancer that spreads to the brain, and they are fine
Yes.
and they are okay. But
Mm-hmm.
when it spreads to that part of the brain that has to do with cognitive function, that is when there is a problem. Because overnight, your loved one does not know you. They cannot speak for themselves, they cannot do anything. They are irrational. It depends like where it is. I have seen people who are manic. They have never been manic, but it's like a switch is switched on and they go 24/7, maybe 3 days without sleeping, and they are talking non-stop. They don't even know what they are talking about. So in a situation like that, the patient does not know their own best. They are not able to state their wishes. And this job falls on the relatives. And the relatives do not agree on what
Mm-hmm.
is best. That is the
Right.
dilemma. You mean A, I mean B, and then there is a fight that adds a layer of stress on the already stressful situation.
Yeah.
But when you state your wishes in the living will, even if you become incoherent or disoriented, they will just refer to the living will. What did they say?
I see.
That is the importance of the living will.
Now, I've been fortunate to never have to ask an oncologist any cancer questions because there hasn't really been any cancer in my family. But like I said, I know a lot of people who have. So the ones who are shocked into hearing those words, cancer, what are some of the questions that they should ask their oncologist before they start any cancer treatment?
There are many questions, but the number, I can say a few, I can go about a few. What is the purpose of the treatment? Is it curative intent or palliative intent? Curative intent is when the intention of the treatment is to cure the cancer. Palliative intent is when the intention is to keep the cancer at bay, to stop it from spreading for a certain time, not all the time, but for a certain time. This will improve your loved one's quality of life. then the moment they don't get those treatments, the cancer will escalate. So people call it like upkeep chemo, some call it upkeep chemo.
Yep.
Yeah. So that is one question you need to ask. But a
Pain
good
management.
oncologist, pain management is individual. I have seen patients who have the same type of diagnosis, but one has extreme pain, the other has no pain.
No pain.
Yeah, so it all depends on the nerves around and what the tumor is pressing on. And so it is individual. We can't take it as a whole. It is individual, and each individual is looked at individually. But when your loved one is in intense pain, ask the oncologist to refer you to a palliative doctor. They are really good in pain management, and many of them, from what I have seen around in this country, they have been working as I have trouble saying that word, in anesthesia. It is a very long word. They are doctors who are specialized in anesthesia, so they are very good with pain management. If your loved one is having trouble managing their pain, ask your oncologist to refer them to a palliative doctor or palliative team. Yes. There are many
We're
questions.
going to take a break before we continue, and we will be right back. Don't go away. And we're back with Esther Mbabazi, and she's an oncologist nurse in Norway. Always wanted to go to Norway. Sounds like such a nice place. Snows there a lot, doesn't it? My next question to Esther is, it's so hard to focus in these days of COVID and everything. How do you focus on what you can do, and how should caregivers focus on what they should do, and how should patients focus? How should we all focus?
We can't control other people.
Well, there's a
right?
shocker.
Adrian is frozen.
Don't
I
worry, she'll
am?
come back.
No, you come back now.
She'll come back.
I can see me.
We can't control other people. We can't control the system. And sometimes I see caregivers trying to control the system. Things tend to move slowly in the system, but there is nothing you can do about that. You see many people getting annoyed and frustrated and irritated, and I was there when my mother was diagnosed with cancer. I was that person who called every office to get her, things moving around and get her treatment as soon as possible. And I wore everybody down who was around me, because, I was crazy, calling everybody and organizing meetings with my siblings to see how we can get this thing moving. And my mother needed some pre-surgery tests because she was 63 at the time. She needed an echocardiogram. She needed other tests. So I called people to ask them to do their work. In my head, I thought they were not doing their work, but they were doing their work. That is their pace, right? So I wore everybody down. I wore myself down. I didn't even think what was best for my mother at that time. I didn't think about her. So I was just, And the interesting thing is I didn't see that before when I was working as a nurse. I saw it after I behaved like that. Then I saw other people do the same thing. And they are all tired and annoyed. People are annoyed at their relatives for not helping in the caregiving duties. They are annoyed at the system. They are annoyed at the MRI machine that is dead, that is not working. They are annoyed. And what this anger does, it goes out to you. It goes out to you, and then that anger emotion comes out, reflects in your actions. Rage to the nearest people who are around you. And who is that? The person you're taking care of. You're impatient with them, the children, if you have small children in the home. you're impatient with them, you're annoyed with them. It's, but if you step back, in your head, step back in your head and try to analyze what it is I can control in this situation. I have like a small system. It is not mine. I learned it in a workshop. Like you have a chest of drawers with different drawers. Oh, and the top drawer are the things you have control over. Okay, what are those? Do we have food in the home? That you have control over. In the next drawer are the things that you can do yourself, but somebody else can come in and help you with those things. For example, I need to speak to my boss. I need a few days of work. I need somebody to sit with me as I speak to my boss, as support. Okay, we don't have food in the home. I need somebody to help me get food. That is the second drawer thing, I can't go out to the store myself. I need somebody to help me buy that food. Then in the third drawer are the things you don't have to think about now. Okay, spring break is coming up, Easter break is coming up. What are the children going to do? That can wait until the Easter break is here. Right?
Yeah.
Because I have seen caregivers who are asking, what are we going to do during the summer?
Mm-hmm.
And it is December, and they are all worked up and they are not sleeping. That can wait until the summer is here. There's nothing you can do. And then the last drawer are the things you have no control over. Me and you, we have no control over the cancer. We don't know whether our loved one will make it. We don't know. We have no control over that. We just have to sit back and see what the treatment does. So me spending 24 hours awake doesn't help.
No.
So, but this is a practice thing. It's like a mindset thing. You need to be talking to yourself all the time and bringing yourself in. I'm going to give an example of something that really shocked me. I had this patient and they came in and they were in very bad shape, pain, and they were throwing up and they were, helpless. So it took us maybe 3 hours to stabilize the patient and do whatever we needed to do and get them in a good, comfortable place. So I went to see how they were doing. Then I asked, how are you feeling? Then the patient said, I'm doing okay. They situation who does not have the help I have. I'm like, what? He said, I'm doing fine. I'm going to die. I can't do anything about that.
Mm.
Yeah. But I know my family loves me. My children love me. I love them back. I got dealt this card. And I can't do anything about it. What? I had never heard of a person like that.
Mm.
So he said, I can't fight it. I don't want to use any more energy. I can't fight it. The doctors have tried everything they can, and here I am. So I have, what did he say? What was the word? I have reconciled. Yeah. So I just want to have a good time with my family. And the moment they got stabilized and everything was up and going, they wanted to go home, to be home in those last days.
Yeah.
Yes.
Yeah, wanted to be home in those last days, not to be spend them.
Quality of home versus a hospital bed.
But I'd never seen anybody reconcile like that. Like, I reconcile, there's nothing I can do. I want to go home and be with my family in these last days. What? I will never forget that patient. Never. Because we complain a lot. No. But he is a person who is dying. They are young. They are dying and they have reconciled with whatever it is.
Probably a strong faith as well.
Yeah.
And there's absolutely no way you can teach that to somebody. That's an inner thing.
I think it is inborn.
So self-care is very important for caregivers, and
Yes.
as you know, 30% of them die before their loved ones do because of the stress. They internalize everything. It
Yes.
turns to cancer. It turns to
Depression.
ulcers. It turns to God knows what. In fact, it wouldn't surprise me if a lot of caregivers were the ones who were coming in to your unit for cancer treatments. But what can a caregiver do to avoid all of that and take care of themselves, put their needs first, put their oxygen mask on first?
Yeah. You know, in the beginning of the caregiving duties, everybody's energized. I can do this. There's one who told me, I'm going 24/7. I said, you can't do that. Then they said, watch me. I said, okay. I said, okay. You can't do this. I said, you can't do that. You can't. No, you watch me. I said, okay, I'll watch you. So in the beginning, everybody's energized. I don't know whether it is the defense mechanism or what it is, but in the beginning, everybody's like, whoop, we have to fight this. We have to get back to where we were. I don't want to see my husband like that, my wife like that, my father like that. He's a strong man. I need to get him back there. But I don't, it is maybe easy for me to say, but we can't fix everything. That is something I have learned along the way. We can't fix our stuff. Sometimes we have to go through that stuff. So I usually tell my caregivers to pace themselves from the start. This is a marathon. This is not a sprint. This is a marathon. Pace yourself. Don't take things for granted. Ask your wife, your husband, what is it they need help with. Don't just assume and take over everything. I have a good friend of mine. She was a caregiver. She's one of those people who assumed their loved one could not do anything anymore. She swooped in and took over. 6 months in, she was burned down. So she stepped back, started going to the gym again a few minutes a week, like that, until she got her energy back. So she told me, I don't know, I thought my husband was helpless. So she had this conversation with her husband, and he asked, why didn't you let me do some stuff?
Keeps them strong while they are strong.
Yeah, you can groom an invalid or you groom independence.
Yep.
So I usually tell caregivers to don't give up all your hobbies. Of course, we are going to go individually. We can't just generalize, but keep your hobbies. It can be knitting. I know somebody who said knitting helped them grieve the loss of their husband.
Yeah, support.
Knitting.
I'm one of those people.
Support groups.
Support groups. Because in support groups, you will meet people who are going through the same situation as you. You will share stories, and your story will help another person, and vice versa.
I like the way you say my caregivers. Like they're your patients, they're your caregivers. Not many nurses will do that. Not many nurses will speak the way you're speaking, showing the compassion and the empathy and the really caring.
Thank you.
Now, there's a lot of great nurses out there, but I don't blame them. They're overworked, underpaid, understaffed, etc. And I feel sorry for them. So I'm curious. Are you working long hours, or have you been over the last year? 18-hour days, two shifts a day, anything like that?
I have done those in the past, but not now.
You were younger.
Yeah, not now. Not now. But I would like to say one thing that I hear caregivers say. They say nobody's offering me help. The thing is, you have to tell people exactly what you need help with.
Yeah.
Don't just say, help me. You need to be precise. You can say, can you help me go to the store, pick up XYZ? can you help me drive my husband or my wife to the treatment center to get her treatments? That is being
Right.
concrete. Can you help me
Specific.
watch my children while I go out to get some fresh air? Because I think you have heard.
Dave has heard me say this many times. You're walking down the street and you're talking to somebody and they said, anything I could do for you, just call me and let me know. And the caregiver doesn't ask for anything. You have to be ready and know what you need and know what you want. People will help you when you're very specific. You're absolutely right.
Another thing I hear mostly, this is from the people who have grown up children, and maybe the wife is taking care of the husband who is their father or stepfather. Then they will complain that the children do not chip in. But the same caregiver is giving a signal that she or he is doing this job very well.
Yeah, they're not good enough.
For this person who has never been a caregiver, they don't know what you need help with. I told one person here to ask her children to chip in, to pool resources so that she could afford a cleaner, someone to come and clean the home, and they did that. The first time she asked, they did it, and she had never asked. So say what you want. Don't just say, don't they see me? I'm taking care of their dad. Oh, no, they don't. Yeah, they are busy. There's Corona and COVID and everything. Everybody's occupied, homeschool, everything. They don't. So just say what you mean, what you would like help with. So,
have you ever been a caregiver? Have you ever been burned out?
Mentally.
With the nursing job?
Yeah, I was a caregiver. I was taking care of my mom, not physically, but the coordinating things and all that. And I have been a perfectionist, so yeah.
How long have you been in Norway?
13 years.
And that's a long time. And where was your mother when
in
you
Uganda.
were? Yeah, long distance caregiving is very much in your head. Yeah. I know.
The hospitals are bad there, and
Your mother had colon cancer?
cervical.
Cervical.
So that means she had a bag, yes?
No, she didn't. She survived that. They thought they were going to do that, but they didn't.
Well, you've seen people with bags, right?
Oh,
what special things? I mean, is that really the end of the world, or is it not so bad?
It depends on your mindset. Yeah. It depends on how you look at things. We look at things differently. So, but I usually tell my patients, what is the alternative?
That's a good point. So what are the challenges when someone's diagnosed with, let's say, colon cancer?
Challenges. Can you give me more?
Well, your mother had what kind of cancer again?
Cervical.
Cervical.
Yeah.
So what kind of challenges does someone with cervical cancer have?
After treatments?
Yeah.
Yeah. Depending on what kind of treatments, if it is radiation can create scar tissue.
Yeah.
And if you're married and you have an active sex life or intimacy, scar tissue causes problems.
Yes.
So we encourage people, our patients, because colorectal cancer can cause scar tissue from the radiation. Many colorectal cancer patients get radiation and they get scar tissue and nerve damage and all that. So we encourage them to see what are they called? A sexologist somebody who has training in intimacy. I don't
Alternate
want to
It
say
ways?
is, yeah.
sex. I don't
A
want to say
sex
sex.
therapist. Yeah.
Yeah, sex therapist. And I have attended twice their lectures, and they were not what I thought because I was scared. It's like maybe too raw. It wasn't at all. So we
You
encourage
went on
people to
behalf of
go.
your mother?
No, I went in my job. I
Hmm.
attended it as
Training.
so we learn how to talk to our patients
Mm-hmm.
because we have prostate cancer patients and they have the same problem.
Yeah.
Prostate cancer and colorectal cancer and cervical cancer, anything that gets radiation down there, it creates scar tissue
Mm-hmm.
and it's painful and it can pose challenges. So couples need to see a therapist to help
I
Yeah.
hear
them
I hear
adapt.
so much about new therapies, that is going to make chemo and radiation obsolete. How far away are those? I mean, there's a thing going on the internet, and I know I shouldn't believe everything on the internet, but
Yeah.
that there's a dewormer for dogs, and that people are taking it, and they are being cured. Yes, cured is the word they use, of cancer. Is there any way that a dog dewormer can cure a person of cancer?
I don't know, I haven't heard of the dewormer, but I saw on TV that dogs are now trained or being trained to to smell the
Smell.
cancer.
Yes.
Yeah, I saw that on TV. So, and I saw recently there is something they are developing in the States there. I don't know, something to do with the immunity again. They are going to use the immune body's immunity system in another way, not like immunotherapy, but in
Yes.
another way. Yeah, I saw it I think yesterday or the other day on TV. So let us see where we are headed.
No, I've seen the dog warmer bit on the internet too, Dave.
What
And
do you think about that?
I I'm certainly skeptical. And you never know. It could be that someone is
Be a
so
breakthrough. Who
vested.
knows?
It could be a breakthrough, and it could just be that somebody believes enough,
Yeah,
really, really believes enough that this is doing something, that
yeah.
their state of mind.
And I don't check their motives because it's the pharmaceuticals that have the profit motive.
Of
And
course.
this guy is saying, hey, you can get it at the drugstore. It's over the counter. The big pharma doesn't want to tell you about it because,
Right.
they want you to spend money on all these cancer drugs. And there's so much distrust about big pharma
Yeah.
that argument flies.
Of course.
Have you heard of
And they
the
owe it to themselves because they've done it to themselves.
Yeah.
yeah? Have you heard of the shark cartilage?
Uh,
The shock.
I don't know, but every time I ask my orthopedic surgeon, he says, you cannot grow cartilage. But I hear all over the place that you can regrow cartilage. So tell me what you know.
Shark cartilage is more like that dog warmer
Shark,
thing.
like the shark in
Shark
the
like the
water.
shark like the yeah.
Yeah.
Shark. Yeah.
I have seen, I have seen. I don't want to laugh. Maybe it works for some people, but I have seen patients spend money on supplements that are
Mhm.
made from the shark cartilage. Somewhere, someone in this world told people that sharks do not get cancer. So
Or
many,
arthritis, probably, huh?
right? So people are buying those supplements and they are not cheap.
No.
They are not cheap, so they are buying them and they are taking them alongside chemotherapy. But I'm yet to see the results. The ones that I know that took them, they are not here anymore. But
Yeah.
they were quite expensive. I
Yep.
think.
Yeah. Charlene went
And
to. But
go
I
ahead.
was I was going to say my wife who had a stroke and lost her speech, lost her paralysis on one side. She went to this doctor. We gave her $10,000, and she was from Africa also. And she had these herbs and she got them from all over the world and She claimed to be able to stop the cancer even if it's stage 4. Well, she's in jail now because they claim that she was defrauding people with cheap herbs and pills and this and that, and the people ended up dying. But yeah, you just don't know what to believe anymore. You want to believe, you want to have
People will
hope.
try, if they're desperate, they will grasp at straws. They'll try anything.
Yeah.
Yeah, they do.
So, taking care of a spouse obviously can be challenging. I will attest to that. What do you know about the disease, treatments, and side effects? And why is it harder taking care of a spouse? You're wearing 2 hats. You're a husband or a wife, and you're a caregiver. And sometimes a caregiver doesn't get the respect that a husband or wife, or maybe I should say that vice versa. Sometimes the husband and wife doesn't get the respect that a stranger caregiver would give. They're very difficult patients. Have you had any experience? Yes, of course you have. Your mother.
Okay, you had so many questions in one. I don't know where to begin.
Yeah, I'm good at that.
Where to begin.
Just pick one and answer it.
You said why is it hard to treat a loved one, to be a caregiver of a loved one?
Yeah,
Spouse.
a spouse.
A
But
spouse, yeah.
a parent is just as hard as a spouse, I think. Maybe even harder. I don't know.
Harder because I know somebody who told me at the peak of COVID around June last year, she told me like their roles had reversed. Her parents were behaving like teenagers. They were going out, they are meeting their friends, they were not listening, and they are in their
Wow, is that good
risk.
or bad?
Yeah, because they have other diseases. They were in the risk category and they were just going out to meet friends, and she talked to them and they wouldn't listen. So I told her to
Imagine
let
that.
them be.
Payback.
Yeah, let them be. So I don't know. I think it is challenging to be a caregiver to a loved one because you wish them the best. You want to see them come out of whatever it is they are going through. You want to take care of them. At the same time, they are their own person. They need to do what they want to do. And when they don't listen to you, then there is tension there. You understand? They are their own person, but you wish them well, and they do not see, they are not able to see that what you're telling them to do or how you're taking care of them is for their own good. I don't know. That is how I see it, and they think it creates strife. There is a patient who told me they were tired, everybody telling them what to do. From when to show up, you need to show up at 9 a.m. for this treatment, and you need to be in bed by this time to rest your body. You need to eat this food to maintain weight. You need. And they were fed up. They were fed up of those rules. And other people will just comply because we are different. Other people will just comply with whatever it is they are being told, and others will resist. And that will
Sure.
create friction between the caregiver and the patient or the care receiver. So you need to let them be. Let people be. However,
However,
however, boundaries work both ways. So when your loved one or your care receiver, your spouse, lands in trouble, they cannot expect you to drop whatever it is you have to take care of them because they don't want to listen to you. They want to do things their own way, and when their own way lands them in trouble, then they cannot come back running to you. So you drop everything you have to. I think it works like that.
sounds like our kids.
Yeah, boundary is a two-way street.
Role reversal.
Yes.
Mm-hmm.
I think,
Wow.
I don't know, but that is a big challenge, taking
So,
care of a grown person.
do you think the caregiver and the loved one have the same understanding of the impact of the disease on the family as a whole?
Nope.
Or is one kind of absorbed in themselves and a little selfish, you know?
No. I don't know whether I would say selfish
Yeah,
because
selfish is a dirty word. Nobody wants to be selfish. But they can be self-absorbed because it's their illness, it's their body. I mean, my wife certainly was, of the attitude, hey, it's all about me. And it is there for a while until they get better, and then they still think it's all about them, and then you have to remind them, no, it's not all about you. It's all about me too.
yeah, because a cancer diagnosis can mean death, so they are probably worried, and they are not able to focus on any other thing. They're just thinking about maybe I'll die, maybe I will not die, maybe I'll make it, maybe I will not make it, and they're oblivious to whatever it is that is going on. So I think it is best to have some compassion from that angle. You are not facing death, the caregiver, and they are facing death, right? So
Yeah.
death is scary. It is scary. So some people are acting from that angle. I'm going to die, So what I would say to a caregiver is to seek services of a therapist to help them sort with all the thoughts that are going in their head to create a better atmosphere at home. Because if you learn to control your mind, your thoughts, because everything starts with us. It doesn't start with the other person, it starts with us. If you want a better environment at home, it starts with me, not with my husband, but with me. So if I learn how to work my mindset, how to sort my thoughts, then maybe it will rub off of him, rub off me to him. So we
Hopefully.
advocate we advocate mental health services to both the patient and the caregiver and the children if they have small children in the home.
Yeah.
Yeah, people
Well,
underestimate the importance of having a therapist or a licensed counselor, psychologist, anybody. It is very important.
I went to, there was a social worker and a psychiatrist who treated us as a couple at the place where my husband was having treatment, and it was invaluable. It really was.
Mm. So
well, it's hard to believe that a whole hour has passed. I am so grateful that you came on the show. You've enlightened us to many things. Is there, in the last 2-3 minutes, is there something that you want to say that you did not have an opportunity to say?
many things,
Many things.
many
The most
things.
important.
Pick one.
I don't know. Pick one. As a caregiver, you cannot do it all. You have probably heard this 1 million times, but you cannot do it all. You need help. Ask for help. There is nothing to be ashamed of. And this will depend on how the relationship was before the cancer came in. But instead of carrying around resentment in you, try to sit with your loved one and talk about how you feel. And have them talk about how they feel to clear the air so you do not carry around resentment because
Yeah.
resentment is a bad thing.
That's exhausting
Yes,
if you carry it around.
yes.
So how can
Mm.
someone get a hold of you if they have further questions they want to ask? Are you going to write a book or anything?
No.
No, you should. You have a lot of stories to tell.
Do I?
And a
Well,
lot of
you just
wisdom.
told us a lot of stories today. And you said I have many things to share. That's why you need to write a book.
Yes, I do. Thank you.
Yeah.
I have
Next time I
a
have you on,
website.
we'll be talking about your book.
Thank you. I have a website that's called ariseheaven.com
Hmm.
/ I have to begin again. The website is called ariseheaven.com, but I have a free guide for caregivers who are just starting
Hmm.
their caregiving duties. It's on ariseheaven.com / spousal care guide.
Forward
And
slash
/ what?
spousal care guide. I can
spousal
write it.
care guide.
Spousal care guide, yes. And
Pousal.
Haven is HAVEN, ariseheaven.com / spousal care guide.
HAV or HEAV?
Haven.
Oh, Haven.
Haven.
HAVN.
Thank you for
Yeah,
clarifying that. Haven.
yeah. I started a website like last week.
Ah,
A podcast last week.
Good for you.
Mm.
You
I
did one
started.
already?
I have 10 episodes on there.
How are they
I
going?
but
You who
uh,
says that you're not very tech savvy is doing a podcast.
yeah, I thought I had done everything right and I didn't get any downloads or anything, so I asked somebody to check and I had not done it correctly. So they helped me. They helped me.
Well,
What
you
is it
still have
called?
the episode. You didn't lose them, right?
No, I didn't.
Good for you.
So my podcast is called the Rethinking Caregiving Podcast.
Wow, your heart is really into caregiving, even though you're a nurse. Good for you.
Yeah. Mm.
Heart of a
I'm
caregiver.
writing it down.
Rethinking, Rethinking Caregiving Podcast.
Ooh, that
You need to
sounds like a great
rethink
title.
how, yeah, we need to rethink how people look at caregiving and all that.
Yep.
So, yeah.
We would be happy to be on your show if you want us to.
Uh, I will. I just need to get
Yeah.
in and understand things, and I don't lose you in the middle of the interview, you know. So, yeah,
Well, you
but I
have my
will reach out.
email.
I do.
Is there contact information on your website?
About the podcast?
Know how to
Hold
get
of you.
Yes.
you.
Yes, it is there.
Okay.
Yeah. Mm.
All right. Well, thank you again for coming on the show. It was delightful, and I can't wait for us to be on your show.
Well,
So,
thank you
everybody,
so
we'll see
much.
you next time, same channel. Bye bye.